Okay, so my name is Langley Flowers. This is Eric Nyman. We're going to go ahead and post. We're both in the same lab, so we're going to post a dual video. So it'll be longer than 3 minutes, but we'll keep it as short as possible. So we're showing this is week 2 and showing the different massages. So the contraindications for massage would be a patient with a bleeding disorder or areas that might have blood clots like DVTs, fractures, open or healing wounds, and skin infections or weakened bones. We don't want to put any direct pressure over a tumor if they've got touch hypersensitivity, which he obviously does not, an embolism, or maybe a pain of unknown origin. And our indications that we'd want to use for massage would be pain relief, muscle spasm reduction, remodeling of the collagen, and systemic relaxation. So the first one, and I'm going to butcher the pronunciations, is effleurage. And so all of these, most of these we can do while having him prone, like how he is right now. And I'm just going to have his shirt off for keep it pretty quick on the video. So effleurage will basically be circular movements that we're coming up, and I hope this is showing it pretty well. And you can do it deep or superficially, coming up like this, and then once we get up to the top area that we'd want, we'd come down in this motion like that. The second one will be petrissage. I don't know if I'm saying that correctly, and that's like to knead. I'm gonna go and come down. It's easier to grab these muscles really quick for demonstration. So it would be essentially picking up the muscle and kneading it like dough in between your hands, like I'm doing right now. That would be petrissage. Friction. So friction would be just kind of maintaining like a certain spot to help out with adhesions and help breaking those up. So coming right in here, maybe getting on the rhomboids or the upper trap, and just maintaining a pressure like that. Good. The next one would be tapotement, which don't know if I'm pronouncing that again. And there's a couple different versions of that. So you have tapping that you can do up on the head like this for the cranial muscles. I'm not showing it that well. Or the one that I like the most is just coming in and just kind of doing chops where you're keeping the fingers loose, coming in on the muscles that you find are tension and delivering those. And then the last of those 5 would be vibration. I'm going to once again come down to the calf muscle. And so this would be getting like I'm taking a secure on the leg down here, and it's shaking back and forth over the muscle, like over the bone on the muscle. And it's shaking to, release adhesions. Very good. And then I'll go ahead and show the myofascial release. So myofascial release, it's going to be a mixture of multiple ones of the first 3 that I kind of went over. So we'll kind of maintain the contact like this and just rub up. So I'm doing on the erector spina muscles like this. Go the opposite direction as well. Very good. And then the last one, can you roll over for me quickly, Eric? And actually just sit right here. Yeah. Actually go and lay down real quick. Sorry about this. I know I'm making it complicated. So this one, easiest one I was going to show it on was really quickly on the patella. So I'm doing this motion right here on the cross friction. So it would be coming down the patella ligament like this, on the tendon and just kind of breaking it up, doing this one just really easily, coming out like that on this. And that can be, that would typically, cross friction would be followed by stretching for a range of motion. And it can be helpful for like reducing the size of muscle scars. Thank you.
Okay, we're going to begin with the contraindications of massage. The patient has a bleeding disorder. If I wouldn't want to do it if the patient is prone to blood clots, fractures, and if they have an open wound, or if they have skin infection, weakened bones, or recent surgeries. And I would not put a pressure over a tumor, or if they have touch hypersensitivity. An indication for massage would be if the patient is looking for pain relief, muscle spasm reduction, remodeling of the collagen, and systemic relaxation. I'm going to start with the patient prone with their shirt off. I'm going to begin with effleurage, and I'm going to start close to the spinous processes, work my way up, and then I would come back down laterally. Next is the petrissage. I would grab the muscle and kind of knead it or wring it out like a towel. The one after that would be friction. So I'd find the spot and put in pressure and maintain it and slightly move up or down or laterally or medially. Next is department. I would find the cranial muscles and slowly push on those, and then as far as to do anything more inferiorly, I would have my fingers relaxed and move over the muscle belly. After that, I would do myofascial release, start at one side and the other and distract. And finally, vibration. I would find a part on the muscle belly, and not really sure how it was done, but slowly create vibrations in the muscle belly.
Mm-hmm.